Hi, my name is Dr. Dana Washburn. I'm the head of Global Medical Services here at Parexel, and I'm very pleased to be here today to talk about the important work that Parexel is doing in cancer therapies. In recognition of World Cancer Day, I'm joined by two of the experts in oncology here at Parexel.
Thanks, Dana. I'm Dr. Todd Schuster. I'm a medical oncologist, and I have the privilege of serving as the Global Therapeutic Area Head for Oncology Hematology here at Parexel.
Hi, my name is Dr. Matthew Cooney. I'm a medical oncologist, and I'm also on the Global Medical Services team, Senior Medical Director for Parexel.
Thanks, Todd. Thanks, Matt. Maybe you can share some information with us about why you went into oncology.
Yeah, sure. So I think my passion for oncology has really evolved over time. It really started out, I think, based on mentors that I was exposed to during my medical training. I think working with cancer patients during training and subsequently in practice. And then I think more recently, I think the passion for clinical research, working to advance the care of patients in the clinic, and working at Parexel has given me an opportunity to continue in clinical research. And I see that it's an incredibly exciting time in oncology, and having the opportunity to participate in that clinical research has really been incredibly rewarding.
Matt?
I think what got me interested in cancer is really people. I've had some tragedy of cancer in my family, and when I decided to go into medicine and go to medical school and train, I just wanted to help the most folks that I could. And I always felt that the cancer patient, the cancer experience, the journey is such a challenging and a tough on everyone involved. And I think that as I went through my training and I had these wonderful mentors, like Todd had mentioned, and they were oncologists, and that's who I wanted to be like. And I think that treating my patients, following their journey, being part of that environment has been so rewarding and so fulfilling. And the great thing here at Parexel, I can get up to work every day, and what I do is I try to make their lives better by the work that we do and the research we help perform.
Thanks. So recently it was announced that the U.S. cancer death rate had declined for the 25th consecutive year, and that last year there were 16 new cancer drugs approved by the FDA. So much progress has been made here in the U.S., and I'm wondering, Matt, if you can share some thoughts on how that is expanding into access around the globe.
Yeah, I mean, so we're making such exciting progress in the treatment of cancer, the diagnosis of cancer. In the United States, with all these exciting new drugs in these trials, and we're delivering medications that we've never dreamed of even 10 years ago. The reality is, on the global level, cancer is still an enormous problem. In Asia, Sub-Saharan Africa, for example, cancer is growing at rates we've never seen before, probably from a variety of factors. Some of it diet, tobacco, alcohol. Other causes could include viruses, are a big cause of cancers across the globe. So part of our work is not just to do the work here in the United States, but our impact is going to affect those around the globe as we see the cancer incidence rise, and we got to push those numbers down, not just here, but everywhere else also.
So as we think about the progress that has been made in cancer therapies and the important work that you and everyone at Parexel is doing, maybe you can share some thoughts on how access to therapies for cancer patients is improving.
Yeah, so at Parexel, oncology has been our busiest area of clinical research. And Parexel has really made an effort to keep up with the need for clinical research across the globe in various regions. So for instance, in Asia, the number of clinical trials that we've run in oncology in Asia is almost the same as what we've done in North America and Europe. And we've seen incredible growth in Asia. So we're running more and more trials, and I expect that the number of trials will likely surpass that of North America and Europe at some point. So Parexel has really kept up with the need for more clinical trials across the globe. The other area is in biosimilars. So biosimilars are really an attempt to try to improve the access to biologics across the globe. These agents are expensive, and access is not possible throughout the globe at this point. So development of biosimilars is a way of improving access to important biologics, really life-changing biologics across the globe.
Thanks, Todd. So as we think about a lot of the advances that have been made, two particular areas where there has been a lot of excitement and focus has been in targeted therapies and in immunotherapy. So Matt, I don't know whether you can share some of your ideas on targeted therapies.
Yeah, I mean, targeted therapy is a pretty incredible story. We went from really a generation or so of giving everybody the same types of chemotherapies just based on their type of cancer. So if you had a lymphoma, everybody got the same lymphoma treatment, or if you had breast cancer, everybody got the same breast cancer treatment. But it's evolved so fast, really going back to the chronic myeloid leukemia, where a genetic change caused the chronic myeloid leukemia, and there was a specific drug that was found to treat it. And since then, it's really taken off, where now almost every drug in almost every cancer is looking for a target specific, not just for that cancer, but specifically for that patient, individualizing it and making sure that patient gets the right medicine for their cancer every time.
Thanks, Matt. And Todd, you mentioned lung cancer. I know that's an area of interest and expertise for you. Maybe you can share some additional thoughts on that area.
Yeah, so I'm particularly interested in lung cancer. I mean, lung cancer is the number one cause of cancer and the number one cause of cancer mortality across the globe. So lung cancer is really a prime example of the advances that have been seen in oncology in recent years. Probably if you look back 20 years ago, chemotherapy was all that was available. More recently, biologic therapies in the form of an angiogenesis inhibitor has been really made available to patients, but in the most recent past, the immune checkpoint inhibitors have really transformed the treatment of lung cancer. Matt mentioned some of the targeted therapies, and again, lung cancer is really the prototype malignancy for targeted therapies. We've seen development of numerous targeted therapies for lung cancer, agents that target specific mutations in lung cancer have been approved in recent years and have really transformed the care of patients. So I'm very excited about what's happened in lung cancer based on targeted therapies and immunotherapy. We're starting to see some long-term survivors with advanced lung cancer, something that we've never seen before.
Thanks, Todd. That's great news.
Yeah.
So Matt, I know that you have had a particular interest in prostate cancer, and I wonder if you could share a few thoughts on where we are with that disease and some of your hopes for the future in the treatment of prostate cancer.
Yeah, prostate cancer story is really incredible. When I first started, there was almost no agents, very few medicines for prostate cancer. Then in 2004, we had our first approval of a chemotherapy. And since then, it's really been a sprint of drug development and new agents. There's over 10 new drugs now for prostate cancer that are readily available for our patients. They work in different ways. Some block the hormones in the body that affect prostate cancer. Some are related to the immune system. Some are chemotherapy. But they all give our patients different options that extend their treatments much, much longer than it has been in the past. Looking at it most recently, in the United States alone, there's several dozen trials just in prostate cancer, just in metastatic prostate cancer. So I think the future is bright, that we'll continue to have our patients live longer and better and have more healthy and quality of life with their prostate cancer illness.
Another area that we've heard a lot about is real-world evidence. So I'm wondering if you have thoughts on how the availability of real-world evidence and real-world data will impact oncology drug development.
What we know from some of the trials that have been done is that these drugs are really unlike chemotherapy agents. The biologics that I mentioned, the immunotherapies, have unique not only mechanisms of action, but also unique toxicities. So how these drugs perform in the real world setting is going to be different than, or may be different from what we see in clinical trials, which are very controlled. Patients are highly selected for clinical trials, so they have to meet specific eligibility criteria. So when these drugs are taken out into the real world, it's unclear whether they perform as well as they do in a clinical trial setting. So this real-world evidence is very important, specifically to payers for these drugs. So how do they hold up in the real world? What are the toxicities? Are the clinical benefits the same when they're used in practice compared with what we're seeing in clinical trials? And so many of the studies that Parexel has been involved in involve a collection of real-world evidence.
Thanks, Todd. Yeah. So with all the important advances that we've discussed today, and it's really an exciting time in oncology in developing new therapies, in the end, it's really all about the patient and the focus on improving the lives of patients and making it easier for patients to participate in clinical trials. And the three of us have obviously spent a lot of time in clinical medicine and have firsthand experience, treating patients and spending time with them. And we know how important it is that the patient perspective is at the core of our work. So I'm wondering if you could share some ideas on what we can do to make this experience easier for patients and to improve their participation in clinical trials.
Sure. So we depend on the patients for participation in clinical trials so that we can see these advances in cancer therapy. Unfortunately, now only a small minority of patients participate in clinical trials. Probably in the U.S., it's less than 5% of patients will participate in a clinical trial. And we need to think very carefully about why that is. Why is it that we get only a small percentage of patients who are able to participate in clinical trials? So thinking about the patient journey, what are the barriers to participating in a clinical trial for patients? How do we remove some of those barriers and make it easier so that patients will be more willing to participate? Thinking about what the patient journey is, thinking about patient centricity, that's something that's become a real focus here at Parexel.
Thanks, Todd. So in recognition of World Cancer Day, we would like to thank all the patients and all the investigators and everyone around the world that is working to advance cancer therapies. Thank you.